Chapter 46, the Ureters and their diseases. Anatomy. The ureter is the excretory duct of the kidney. It is a fibromuscular tube beginning at the funnel-shaped neck of the renal pelvis and terminating at the lateral angle of the trigone of the bladder. There is normally one ureter for each kidney. Each ureter is from 25 to 30 centimeters long. The ureter is, when empty, a closed tube like the urethra. Its physiological caliber is that of a cylinder about 0.3 centimeters, 1/8 inch in diameter. The lumen of the ureter is slightly constricted at 4 points. 1, a distinct narrowing at a point about 2 centimeters from its upper extremity. 2, a slight narrowing where it crosses the brim of the pelvis. 3, a muscular constriction at its entrance into the bladder wall, and 4, at the vesical orifice. Structure. The ureter is composed of 3 coats, the fibrous, the muscular, and the mucous. The fibrous external coat runs continuously from the fibrous envelope of the kidney and its pelvis to the bladder. It is a tough, glistening, elastic tissue. The muscular coat consists of an external longitudinal and an internal circular layer of smooth muscle. It is well developed in both the ureter and the pelvis of the kidney. In the calyces, it thins out to a few stray fibers. At the vesical extremity of the ureter, its muscle pierces that of the bladder and is continued as a band of fibers running along each edge of the trigone. Thus, there is one band joining the 2 ureters, interureteric muscle, which sometimes raises a distinct transverse fold in the mucous membrane, while another thinner band of fibers runs from each ureter toward the neck of the bladder. The ureter possesses no proper sphincter. Its power of resisting regurgitation from the bladder is due to its oblique course through the muscular wall of the bladder and to the constriction of the bladder muscle, which automatically closes the ureteral orifices as it contracts to force the urine into the urethra. The mucous membrane of the ureter is smooth and thrown into longitudinal folds when the organ is collapsed. The epithelium consists of several superposed layers, the deeper ones conical or ovoidal, the superficial ones cuboidal or flattened. Though some expert microscopists claim to be able to distinguish the epithelium of the pelvis of the kidney from that of the ureter, most conservative observers confess their inability to make such a distinction and do not even venture to assert that any given cells in the urine come from any part of the ureter or its pelvis unless the presumption is confirmed by other signs, notably the presence of renal casts and albumin. Relations. The ureter lies immediately behind the peritoneum throughout almost its whole length. It is firmly attached to this structure, so that when the peritoneum is detached from the parietes, the ureter is carried with it. When this dissection is performed by the finger, the ureter may be identified as a cord interrupting the smooth, yielding surface of the peritoneum within 3 centimeters, 1.5 inches, of the spinal column. In the abdomen, the ureter lies upon the psoas muscle and crosses the genitocrural nerve. It is in turn crossed by the spermatic or ovarian vessels. On the right side, it lies close to the vena cava. At the brim of the pelvis, it crosses the common iliac vessels at or near their bifurcation. Thence, it plunges down in a fold of peritoneum, posterior false ligament of the bladder, passes under the arch of the vas deferens, external to it, entering the bladder wall close above the seminal vesicle and about 2 centimeters from the median line. Thence, it runs 2 centimeters obliquely forward and inward through the bladder muscle and beneath the mucous membrane, and emerges at the angle of the trigone, 3 centimeters from its fellow and the same distance from the urethral orifice. Topographical anatomy. The ureter, like the appendix, cannot be felt when normal. When tender or enlarged, however, in a thin subject, it may be traced almost from the kidney to the brim of the pelvis. In fleshy subjects, it can only be felt at this latter point, viz. At the outer edge of the rectus muscle on a line joining the anterior spines of the ilia. In the female pelvis, the diseased ureter is felt through the vaginal vault almost up to the pelvic brim. But in the male, it is only in exceptional cases that tenderness or enlargement at the lower extremity of the ureter can be appreciated by rectal touch in the region just internal to the base of the seminal vesicle.